Hi, and welcome to another video presentation on cognitive assessment. Today I'll be talking about the working relationship between the clinician and the patient, which I believe to be essential for an adequate assessment. The working relationship begins during the interview, but then continues throughout the assessment. The clinical interview should never take the form of a checklist of items that the clinician methodically goes through one at a time, and it can't appear and feel like an interrogation. Rather, the interview should be an empathic dialogue between a concerned clinician and a worried patient that opens up the patient to sharing experiences, going into the details of symptoms, and informing the clinician as much as possible in a joint venture in terms of completing the assessment. For example, when I see a patient with balance problems, I don't ask directly about balance because I've learned that this does not provide much information. I start in gently by asking, have you become more cautious about how you move? This allows the patient to open up rather than close off to too specific a question too soon. I also try to get beyond simple answers in order to find more detail about the patient's experiences. Many patients with vestibular system trauma say they have trouble reading beyond 15 to 20 minutes. I want to know what happens if they try to read for a longer period of time. This often opens a gateway into a discussion of symptoms that might not otherwise have been disclosed. Throughout the interview, information is related back to the personal history of the patient whenever possible. A recent patient of mine felt like the oddball in her family because she read so much of the time. I pointed out that this might not have seemed so odd in many families. Throughout this process of the interview, a joining takes place between the clinician and the patient that often is invaluable in terms of completing the assessment with the maximum of understanding. Next time, I'll look at the testing process itself and how this working relationship continues. Thank you.